Hello everybody. In this short video, we'd just like to share with you just some results from a recent service evaluation we did of our services here at Cancer Care West Support Centre in Galway. In case you're not aware, Cancer Care West Support Centre provides support services to people impacted by cancer in Galway and along the west coast to northwest of Ireland for over the last 10 years. Some of the primary services we have are oncology nursing advice and information, a range of psychology services from the psychology and psychotherapy team, physiotherapy services, and a range of other support services and complementary services, including relaxation classes, yoga, benefits advice, and therapeutic treatments like manual lymphatic drainage. So in 2020, we decided to complete an evaluation of all of our services here at the Support Centre in Cancer Care West, really based on people's experiences with the service in the previous 12 months. Thank you again to everybody who participated. Your time and your input has been really, really valuable and is allowing us to feedback to people now based on your experiences and on your thoughts. The reason in doing the service evaluation is that it is people who are impacted by cancer, and we really wanted to learn from your experiences with the service to see what was working well and areas of change that might be needed. So 78 participants took part between January and March of last year. They completed a questionnaire either in person or online, just really outlining their experiences with the service in the previous 12 months. The kind of questions we were asking was how they had first heard about the service, what it was like first attending, interacting with the team, and their overall experiences. Largely, results have been really positive, and we're delighted to see that really most people felt that the service met their expectations, that the environment and the facilities were suitable, really that their first experience and first visit to the centre was largely positive. And really that people actually felt they benefited from the input, that the input they received from the team actually helped in dealing with some of their primary reasons for attending. So overall, the feedback has been really positive, which we're delighted to see. But I suppose there were some things that came out of the evaluation that we thought might be really helpful for you to know. And particularly maybe if you're somebody who hasn't attended the service before, and who might be very much new to cancer support services. Some of the factors that had made it difficult for people to contact the service for the first time or to make their first visit were really highlighted by the participants in this study. Things like feeling that maybe others were worse off and that it wasn't for them, really the fear of actually talking about cancer, around actually in any way processing the diagnosis, or even feeling that talking about it might make it feel really real, and that was quite frightening and quite daunting. Finding it difficult to attend the service, and when you don't know people walking into a new service, really just not knowing what to expect, uncertainty around what the service even provided. Maybe their own feelings of nervousness or shyness in attending a service. Other factors as well, like the type of cancer. For some people, the type of cancer they had made it feel for them that it would be more difficult to discuss. Feeling maybe quite stressed, quite shocked and overwhelmed. And for others, maybe if they were younger, feeling that they were too young and feeling that it was difficult maybe to contact the service or engage in the service in that way. I guess really the reason we're trying to highlight this is because these are the experiences the participants had kindly shared with us, and if these are factors that might be impacting yourself or making barriers, I suppose, for you in linking with support services, please just not to feel on your own with it, that we very much understand that it can be quite daunting, and you're certainly not on your own if you're feeling some of these difficulties in linking with any support services. On the other side, some of the factors that made it easier for people to contact the service or help make their first visit more positive were things like the staff, their interactions with the staff and the team, feeling that the staff were pleasant, were friendly, informative, professional. The welcome that they received, whether that was over the phone or on their arrival at the support centre, feeling that warmth and welcome and supportive feeling in being there. The environment itself was helpful for some people, just feeling that it was homely, that it was comfortable, that it was a warm, relaxing, place to attend, and the offer of refreshments, even just having that kind of atmosphere helped for some people in just reducing their stress in attending. A big factor for a lot of people was having been encouraged to attend the support centre by maybe their doctors or nurses, any health professionals that are treating them. Getting that recommendation from their team seemed to make it easier, I suppose, in a way, or helped encourage people to attend. But I suppose not everybody might have yet heard that from their team. So if you're someone who maybe your team hasn't yet mentioned it, not to let that be a barrier either, that we're very much here and able to support people whether it's been recommended by your team or not. Similarly, getting recommendations from a friend or someone else that has used the service seems to be helpful for people as well. For some, the location of the support centre was very accessible and was a supportive factor in them linking in and accessing the services. For others, being accompanied to their first appointment, maybe by a family member or by a friend, was helpful, and that's certainly very welcome. Maybe having been aware of the service before, or having Googled the service in advance, or having had initial email contact also helped break down some barriers and make it more supportive for people. Really, I guess these are the main kind of factors that people reported, but there were others as well. But really the aim in this is really trying to highlight to you if these are things that are impacting yourself, not to feel on your own, and please to link in to the services that are here. Overall, again, thank you so much to everybody who participated, because your input has been really valuable and has helped us to inform our development planning for 2021. Some of the feedback has led to changes already, like the development of a quarterly email newsletter that will be launched later this summer, so that we're hoping we can keep people up to date more with events and talks and services at the support centre. We're aiming to increase our group events and talks. Currently, a lot of this is still online through webinars and online meetings, but hopefully in time that we can return again to in-person events when it's safe to do so. And also some physical changes to the support centre, including the addition of shelves in the bathroom, maybe to support people in using stoma care and in trying to manage that care. So really, I suppose, trying to communicate that we're very interested and welcoming of your feedback and input of your services if you do use our services, and please feel free to contact us below with any input you might have. Also, if you feel you may benefit from our services and have not linked in before, please don't hesitate to get in touch. You can contact us on 091 540040 or using any of the links below. Thanks for your time in watching this talk today.